Hello, I'm Andrew Kohlmeyer. I'm a medical massage provider, and I would like to talk about shoulder problems. So we got frozen shoulder, where you can't move your arm and it hurts so much, and you just got general shoulder issues. You got elevation problems that can happen. Yeah, those are the things we're going to talk about. So this is the joint capsule here. So this is the biceps muscle. It has to run up inside of that joint capsule, and you can see it's got like a ball and the sucker stick part of it. You can't have mineralization that is between the muscle and this tendon sheath here. And what I mean by mineralization is what happens is you hold back cortisol here from poor drainage into lymphatics. So everything drains lymphatically to about right there. You have a subclavian vein that runs right under there, and your lymphatics all drain to there for the shoulder. So basically, your drainage gets sluggish. You get a bunch of mineralization here, and that sets off that chemistry change where you have high cortisol in the whole shoulder. Your body thinks that you've broken a bone. You haven't broken a bone, though. So it just acts in the same way by placing soft tissue mineralization where it sees the high cortisol. So yeah, so your shoulder swells because you're like painting every ceiling in your house, whatever. And yeah, you're going to have that hold back of cortisol that's going to mineralize that tissue. Then it's, there's some genetics involved in there by how many of the cells that you have from birth that are available to put the mineralization back in the bone. Those are called osteoblasts. They put the mineralization back in the bone. Osteoclasts are what take it out. So it's very simple, so don't worry about all that. But basically, if you have shoulder problems, you want to check here, and it's easy to clean this stuff up. All the muscles run down just kind of like this. They're all basically in this direction. So you just go the opposite way. You're not gliding on the skin. You're not going like this. You're working deep into that tissue to clean up that area. To change that chemistry value. So your body's like, okay, now everything's healed up in there. The bones are fine. So yeah. So again, the ball, the sucker stick, and you can't have mineralization on those things. So again, it's the same thing. Everything runs this way for that shoulder thing, shoulder joint capsule deal, and you just clean it up. Just let pain be your guide. Break up that stuff. You'll get a feeling for like, oh yeah, that's that mineralization in there that he was talking about. And you can just grind it out. And I'm going to pull this shoulder joint out so you can see what that looks like with that gone. So yeah, so you get, a little bit of mineralization. I don't have anything to point with. But yeah, so you can just use, that deep friction into there to clean that up, because that's what that is there. See if we can tilt this a little bit so you can see. So you just get mineralization next to that. It feels like the end of the world for your joint when you have a big pile of stuff in there, because every movement is just sawing that mineralization. You move and it just cuts you internally. It just gets worse and worse the more you move it. Not to bag on physical therapy, but they make you move your arm more, and just like it can make it worse. Like you have really got to clean that stuff up. You can use a massage gun on it and stuff like that. You're really not going to hurt it. You can kind of be a knucklehead and bruise it a little bit, but you're not going to really hurt it with the massage gun. You don't want to get too crazy on it. And this is supraspinatus here, so this is what hauls your arm up the first 10%, then your deltoid takes over. So you have to have this muscle be of a good tone. You can't have, again, the mineralization into there, because this muscle won't collapse in its own length, and you won't be able to bring your arm up fast enough. Your arm should just go right up, no labor involved. And that's because, we'll tilt this up a little bit more. You get a little bit of mineralization right there. Then you can see that this muscle has to slide under that bone there, and that ain't going to work out too good, having a whole pile of mineralization into there. So again, you can go up and just kind of grind that stuff out. You'll feel it. It's really important right there to clean that up so you don't have that swelling the swelling, what it's going to do, it's going to cause tension in this muscle. You don't have control over that muscle anymore. It's locked in an electrical fault. So that muscle won't collapse into its own self when you raise your arm upright. It'll bunch up. Your deltoid's going to, just squish that muscle into there, and you're not going to be able to raise your arm. It's just going to kill to raise your arm up like that. Yeah, that's not going to feel so good. Let's talk about some frozen shoulder. I got to do some, I got to put a piece of connective tissue in there. I'll show you that. We'll discuss that stuff. Bear with me for a second. So this is the lateral intermuscular septum of the arm, and this kind of divides biceps and triceps. It's not really a well-known thing what happens here. Let me spin that around so you can kind of see where that is. Yeah. So that'll get pretty crusty, and you won't be able to divide the biceps in the front and the triceps in the back. They'll get glued together. You're going to raise your arm up with that frozen shoulder stuff. Oh, it's going to kill. And it's a unique thing to get that out. You make your hand like a hook and you pull, just trying to break up that adhesion between the biceps and the triceps. You got to just grind that kind of out there, because you can't even, you can't externally rotate, you can't internally rotate. So bad, yeah. You can hang your arm down like an elephant and move it around. You can twist your whole arm bone so your humerus is turning, rotating into there, and it'll help free some stuff. But the big thing is to make a hook of your hand, put it on there, and yank. And you'll feel it. Again, let pain be your guide with the stuff. There's a little, a nerve runs through a little tube here. Let me see if I can show you that. Deal with there. Hopefully you can see. There's a nerve that runs there. I forget which nerve it is, but if you get that pretty crusted up, it's about there in the arm. You'll go back, and that nerve's supposed to slide in that tube. Oh, it'll feel like it's just dropping you. It feels like you're just ripping a electrical cord out of your brain. It goes from 0 to 10 in a blink of an eye, millisecond. That's pretty disturbing, because you're like, what is going on now? And that is just, you got to get in there on it and break up that mineralization into that sheath. So you're literally just going like that. Again, no glide on the skin. Break it up. Yeah, so let's go back and talk about, drainage into the shoulder itself. For lymphatics, everything's got to drain up through that clavicle border there to get to, the lymphatic duct and hit the subclavian vein. It's like a intersection there between the lymphatic duct and that subclavian vein, and it just dumps right into the heart. Let me try to show you that stuff. Bear with me again. Let's throw some lymphatic stuff in there. So yeah. This is the sink drain for the whole, this would be the left side. The right side's just the right lymphatic duct. The left side does everything for drainage. 2 legs, half the torso, half the head, face and neck, drain into that. So if that's not draining very good, you got some, you're starting to get some problems. I'll show you that. So yeah, that runs down the shoulder. Everything kind of communicates to that in the torso. The leg at the bottom of this would be their cisterna chyli, and that's everything in the legs has to hit there, and that's at L2 vertebrae. Yep. So it's very easy to diagnose these issues. I don't like to say diagnose, but you could observe what's going on very easily. It's not even it's like, okay, like the door fell off the hinges. It's pretty, you could observe that. It's just that apparent. There's no great wizardry that goes on in your mind when you see what's going on with people. So yeah, so the whole shoulder has to drain into that. So if the sink is clogged here, you get the whole shoulder is going to be that high cortisol situation. Things you can do to cheat against this. There's a couple supplements. You have ashwagandha. It's a mild diuretic. They call it an adaptogen, whatever. It's just a mild diuretic. It helps you get rid of the swelling, the edema, that buildup of lymphatic fluid. Gets it to your heart faster. That's all it's doing. It's a plant root. You ingest it. It changes how your digestive tract drains into this, and you get rid of this stuff faster. So your pressure gets low at your body's core, and everything else has to follow suit. You have to take that twice a day, every 12 hours, because it doesn't really absorb in your fat. It's gone. When your body excretes it, it's history. And the other one is taurine. Taurine is an adrenal gland blocker that is going to keep you from getting anxious, because again, the buildup of fluid isn't just cortisol, it's also adrenaline. That adrenaline is going to make you anxious, so you'll see people with less osteoblasts, that's the cells that help remodel bone. They're just more prone to swelling, and they're holding back that adrenaline. They're anxious people, and if they're not controlling their adrenal glands, on the top of their kidneys, from releasing relentless amounts of adrenaline and cortisol all day with anxiety, you're just getting taken apart at the seams. So the deal with that, and this is why it's in energy drinks too, it's taurine. Taurine is an adrenal gland dampener. It's going to help you control that overexpression of, adrenaline and cortisol out of your adrenal glands to keep you calm during the day, Yeah, and again, that one's twice a day, that's basically it. If you keep, keep this reasonably clean here, take the supplements, you're going to do fine. You're going to do really good. In a couple months, you're really not going to have to address too much, but, you can go by your family history. If you have a strong family history of cognitive decline, osteoarthritis, osteopenia, osteoporosis, all the osteo things are the people that are born with less osteoblasts. Cognitive decline is not a great mystery. They're like, oh, dementia, Alzheimer's, what's going on there? When you see people in a care home, they're shriveled up. They're losing a lot of bone mass. That bone mass is just blown through their body. That soft tissue mineralization is just rampant. You can't have that in your brain. That's going to just destroy neurons. They're just going to be, it's like pouring concrete in the motherboard of a computer. It's just not going to work out. Yeah, crossword puzzles aren't going to help you. So, yeah. All right, that's shoulder talk and a bunch of other stuff, too, and mixed in there. All right, thank you. Bye.